Good afternoon, everybody. I'm Debbie Riley, and I'm the CEO for the Center for Adoption Support and Education. And I'm really thrilled, as the introducer said, we have so many of you listening in today, and really excited that you could take some time out of your life. I know it's a challenging time for all of us to join Lisa and I in hopefully what will be a enlightening presentation and offer you an engagement in a training program that I think will be really impactful for your clinical work. So again, welcome, and I'm excited to introduce to you Lisa. I don't know, Lisa, if you want to share anything about yourself and say hello.
Sure. Hi, I'm Lisa Maynard. I am an implementation specialist with NTI and have been working on this project for about 4 years now. And again, really excited to be here with all of you. I appreciate you taking your time out to learn more about how NTI can benefit mental health professionals. And hope you enjoy our webinar and sign up for our training.
Thanks, Lisa. So I'm just going to give you a quick overview just to ground us in the organization in CASE. I'm hoping many of you are familiar with us, but if not, CASE was founded over 23 years ago, and I'm one of the co-founders in designing a comprehensive mental health organization to specialize in the support of the foster care and adoption community. And so our direct services are in the Washington, D.C. metropolitan area, Maryland, Virginia, D.C. And then our training component is nationally and internationally known. So I hope you'll familiarize yourself. We have some wonderful resources besides what we're going to share today, and the website's up there for your review. So next slide talks a little bit about the program that Lisa and I want to focus on today, which we call NTI, the National Adoption Competency Mental Health Training Initiative. I'm a mental health provider of almost 40 years, and I'm also an adoptive parent, and became interested in this work probably about 30 some years ago. And maybe many of you, for the same reason, that I had seen an overrepresentation of adoptive families in higher levels of mental health. And when thought about building our family through adoption, was kind of perplexed by why that might be. And so began reading and studying, and that's what led me into co-founding CASE. And then as a result of the work here, we see about 800 families a year. I became acutely aware of what I didn't know as a mental health practitioner. And so really began to think about, was there a special niche and what did that look like? And came to this place where I truly believe in my soul that, we're all really skilled practitioners, but I think this is a special specialization as a mental health provider. And so in 2014, CASE had the opportunity, we competitively competed for a large federal initiative, and we were awarded this opportunity through the Children's Bureau, United States Department of Health and Human Services Administration for Children and Families, to create 2 state-of-the-art web-based training programs to infuse adoption competency training into all child welfare agencies, tribes and territories across the country, and into the mental health communities. And so today, Lisa and I will be focusing on one of the 2 products, which is for mental health professionals. And our goal was to enhance the capacity of all of us as mental health practitioners to really address and meet the challenges of youth in foster care, adoption, and guardianship. So as Lisa said, it was a 5-year initiative. It was to kind of come to a close in 2019. I'm excited to share that we were able to garner additional funding. So we're actually in our 6th year, and you'll hear a lot more from Lisa about what this product looks like. Just to ground it even further, we pulled together a very vibrant, I'd say highly talented, well-respected group of national experts in the field some with lived experience, others researchers, practitioners, to really help us hone in on what should be these competencies in the area of adoption competency. And would then develop this curriculum that you're going to learn more about today with those key competencies. So some of the folks up here are on the right-hand side, Dr. David Brzezinski, who's a well-known author and sort of pioneer in adoption researcher. In the middle, Terry Cross, who's with NICWA. So we really are proud about the cultural competency of this curriculum and how it can cross over in so many populations. On the left side of the screen is probably somebody that you know very well, Joe Crumbly, who's an expert in kinship care and transracial adoption, and Dr. Ruth McCrory, who's done a lot of work and research and leader in the field of transracial adoption, and Uma Ayuwaya, who has been a longtime practitioner and leader in the area of child welfare. And then one of our youth who experienced foster care and aged out of foster care and provided us a lot of insights into what she had not gotten from a mental health perspective and the needs that she had, and wish that some of the knowledge that she wishes her therapists knew. So there are many others, and if you want to learn more, you can go to the NTI website and I'll give you an overview, but really a vibrant group of individuals that to this day stay dedicated to this issue. So I'm going to turn it over to Lise that's going to talk a little bit about our agenda.
Yeah, so thank you, Debbie. And I just want to reiterate the folks that helped to put this together are just top notch in the field, and all of our advisors and advisory board members can be found on our website, www.adoptionsupport.org/NTI. So today we're going to share a little bit about NTI, just to give you a brief overview. We're going to talk about the case for enhancing adoption competency to better meet the needs of children and families. How can this lack of understanding of the unique issues of adoption harm rather than help? So we want to really provide you with the tools and strategies to be as helpful as possible to the families and children. We're going to talk about the core competencies woven throughout NTI. We'll share some of the evidence-based and trauma-informed skills and tools to support permanency that are embedded in NTI. And then we'll give you an opportunity to ask any questions that you might have regarding our training, access to the training, and so on. For most children, adoption itself is a significant protective factor, bringing permanency, safety, and a nurturing environment to children who have generally been in less than adequate situations. Even so, the incidence of emotional and behavioral problems is 3 to 6 times higher for youth in foster care than those in non-custodial placements. You can see some of the statistics here. 40% of youth adopted from foster care are diagnosed with ADHD, and often with a high incidence of prenatal drug and alcohol exposure. The American Academy of Pediatrics estimates that 30% of children in foster care have severe emotional, behavioral, and developmental problems. The American Academy of Pediatrics says that mental health and behavioral health are the greatest unmet needs of this population. A few more statistics to stress the point. 1/3 of adolescents referred for psychotherapy are adopted. Approximately 5 to 17% of adopted adolescents receive mental health services, although they represent only 2% of the population. And adolescence is the peak period for psychiatric referrals in the life of an adopted person. NTI was developed to address this need. NTI is a free, web-based, self-paced training that enables mental health professionals to better address the mental health needs of children in foster, adoptive, or guardianship families. NTI really seeks to advance practice for permanency and well-being, to support children and families, and really to support permanency through the lifespan. NTI supports a common core of mental health and adoption learning to enhance the ability of child welfare and mental health professionals to speak a shared language and to collaborate to better serve adopted children and their forever families. We've worked across the country to support this collaboration between child welfare and mental health to improve permanency outcomes and the health and well-being of these families across the U.S. I'm going to talk a little bit more about our pilot in a minute. With more than 135,000 adoptions every year in the United States, NTI is guided by these principles. Adoption is lifelong and intergenerational. Loss and grief are central. Secure attachments can be built and rebuilt. Identity formation is much more complex in the adoption triad. Race, ethnicity, culture, class, gender identity have a very unique role in adoption. And we really understand that and believe that specialized training is necessary. Some other kind of key points: healing from trauma, loss, and insecure attachments really occurs in the context of trusting family relationships. Healing happens in family, and our program supports that. Adoption and guardianship family formation is a lifelong intergenerational process, and connections matter. These are just some more of the guiding principles that are woven throughout the training. NTI was piloted, as Debbie mentioned, in the last several years. We were actually did the pilots in 2017 through 2019. We started with the child welfare pilot, and in the second pilot did mental health. We worked across the U.S., as you can see from this map: Maine, South Carolina, Tennessee, Illinois, Minnesota, Oklahoma, California, and Washington State. And our ninth site was the Cherokee Nation and Niqua, roundabout Oklahoma. And we had nearly 10,000 child welfare and mental health professionals participating. And of that 10,000, there were nearly 2,500 completed in the mental health pilot. We just looked up the stats just prior to getting on this webinar, and we currently have 942 users enrolled in the mental health training. Our pilot is completed, and so we have 942 new users. I'm so excited about that, and really hoping that everybody who's on this call is going to join the party. It's a great training. We've had a lot of really terrific feedback from it. We conducted extensive evaluation with all of our pilot sites. This slide here shows the difference between pre-test and post-test scores for the mental health training. So we did the evaluation both with the child welfare and the mental health trainings, and for this webinar we're just going to focus on mental health. But as you can see from this graph, folks who took the pre-test in mental health, and again, this is about 2,500 people, didn't test so well on the pre-test. We were really surprised with the scores, understanding that mental health professionals have a lot of education, have a lot of knowledge, have a lot of experience, but in terms of adoption competency, scored pretty low on things that are pretty important to this arena. The lowest score was here in Module 5, which is Attachment and Child Development. Module 6 is Race, Ethnicity, Culture, and Diversity. And Module 7 is Identity Formation. So, pretty low scores here. On the post-tests, all over 90%, and most over 95%. So great knowledge gains in all of these areas. We were really happy to see that. And I think it really speaks to the efficacy of the training itself. Participants in the mental health pilot reported a number of ways in which NTI enhanced their day-to-day practice, including improved feelings of competency when working with foster, adoptive, and guardianship families. They also noted that the training was relevant beyond adoption, which is something to sort of keep in mind, such as working with divorcing families and blended families, and also families as they're just coming into the child welfare system through CPS. So really covers the scope from entry into the child welfare system through post-placement and post-permanency for mental health professionals. Participants reported an increased awareness of race and culture, how transracial adoption impacts a person's sense of belonging and identity. They reported greater understanding of how grief and loss may be unique in adoption, especially related to ambiguous loss where a child's birth family is alive but out of reach. Another interesting finding that we found, something we found really interesting, was that therapists reported a greater understanding of the importance of including parents in the therapy to build attachment and to provide more effective parenting strategies. So some really important knowledge gains, some really important awareness, really great changes in day-to-day practice that the folks who participated reported to us. These core messages are embedded in the NTI training. Therapists working with children and parents have a critical role in helping children tell and understand their stories, and helping parents understand the impact of grief and loss and trauma on their child's development, behavior, and ability to attach. This becomes really important when we're talking about behavioral issues and having an understanding that things that might seem sort of over the top or manipulative are most likely, in many cases, related to that trauma or loss and grief, and how to approach those issues is different than just straight up manipulation. Parents have a critical role in helping, therapists have a critical role in helping parents reframe their child's needs and in helping parents honor and maintain their child's connections with birth family, community, and culture. And by that, we don't necessarily mean having day-to-day visits, but helping them understand that there's a sense and possibility for connection in some way. Therapists can learn new tools and strategies to support healing through understanding the big picture factors shaping child's adjustment in adoptive and guardianship families. So this means we don't need necessarily a new model. We focus on neurobiology and ACEs. We talk about therapeutic parenting strategies that differentiate can't versus won't behaviors. That's a really big part of this. And again, understanding the big picture.
Thanks, Lise. So one thing I just want to let everybody know that hopefully will keep you on the webinar a little bit longer, and we probably didn't say this from the beginning, that this training is free, and I know we'll talk about that more, but that should keep you engaged for a little bit longer. As we began to meet the charge from the Children's Bureau, you know, as I said before, we were to create a state-of-the-art training. So NTI as a tool is going to provide you with some of the best strategies, some of the evidence-based protocols that we know are effective in working with this population of children. And most importantly, I think the tools. What we were hearing in the evaluation is that both child welfare workers and also mental health providers wanted some more hands-on tools. So this training is just rich in being able to help support children to heal from trauma and loss. I think to provide parents with skills to effectively parent, particularly in therapeutic parenting when you're supporting traumatized children. And ultimately, our goal is to improve the child and family well-being and in the adoption arena to ensure that we're increasing family stability. So I want to talk a little bit about some of the common misperceptions or myths that kind of drive the need for this work. Often I think adoption is seen as second best. There's a belief that you can't really love a child who isn't biologically related to you, perception that birth parents are irresponsible. Adoptees are lucky. They should be grateful for this wonderful experience that they've been given to join this family. Adoption's a piece of cake, a walk in the park. You know, you don't have to give birth to a child. And the whole area of adoptees really don't want to search. They don't love their birth families. They don't want to be connected. And I think most importantly in our world as mental health providers, that there is a bias that adoptees have more emotional problems than other people. And I think that that bias has been driven by misinformation and I think the lack of training that we're trying to deliver today. So some of the core issues that will be woven in this training will be issues that are related to loss at the core of this work. And I think that, you know, we can go back and look at those findings a little bit later, but we want you to understand that the loss work is probably the sort of, as I said, the hub of the wheel. And the reality is that all of these children that you will be working with through, you know, the lifespan have lost the opportunity to be raised with their biological families. And for many of the parents that you'll be supporting, they too have parallel losses, whether it's infertility that brought them to adoption and the grief and loss surrounding that as well. The issue of rejection, of children feeling that they were not wanted, they were unwanted, they were given away, they weren't cared for. Starting the world with that self-concept is one that has great impact on, I think, the mental health of the children that you'll be supporting. Issues surrounding guilt and shame, and then along with the aspect of loss is grief. And I think that this is another key aspect of the clinical work that we hope that from this training you will do more of, is really to provide children the opportunity to grieve. And we know that children grieve behaviorally very differently than adults might. The next core issue that we'll take a little time with today too is around identity of adopted children often feeling incomplete and at a loss regarding their identity because of gaps of their family history, and also the power of not having this genetic connection and genetic information. The area of intimacy, I think for a lot of our children who've been in and out of care, whether it's in foster care or post-institutionalized children, children have been adopted internationally, the impact of many different caregivers or lack of really loving, predictable caretaking has led to compromised intimacy in the present and the future. And then this issue of mastery and control of children feeling not in control and really anxious about that, where there were so many people that made such powerful decisions about their life. So this is just a smattering of some of the issues. We know that children's understanding and influence around adoption and their adjustment is really impacted by their cognitive capacity, the developing coping skills, and really the opportunity to communicate about their thoughts and feelings. So we're going to say over and over again that communicating is key, and we hope that you will be a facilitator of that communication with the adoptee and their family. The power that adoption has in the life of the adoptee and those in the what we call the kinship network. I think we sometimes underestimate what that power is, and really stepping back and thinking about how adoption transposes a person from one place to another, that these issues are not pathological, that we're here to normalize, that these are normal inherent issues in the life of an adoptee and those supporting them. As I've shared before about the power of loss, there's so many themes, and we've just put in up a few for you to think about today, that many of our children have lost a culture and traditions. For those adopted internationally, a language. Many of our kids have experienced movement in so many families with so many different religions. Certainly the issue of racial connections, with the high rate of transracial adoption and the implications around that, the loss of siblings. I spoke about the genetic component, not having medical information. And then, you think about the time that we've spent in training around birth order and the birth legend and how important that is, and not having that information. And then at the core, again, the sense of genealogical continuity, of not knowing anyone in this world that's genetically connected to you. So, why are we spending so much time talking about, this loss and this issue of connection? And I think, again, what matters to you when you think about those that are surrounding you right now and those that are helping to support you right now during these challenging times, and think about what it's like for many kids who have had such severed connections or lost connections. So again, thinking about the implications of loss and grief, and how you might, I think with this training, begin to weave this into your work. Module 5 in this training really digs deep into these issues of multiple moves and interrupted developmental stages, the lack of continuity in relationships, and how that interferes with the formation of self and compounds, I think, mental health issues, and certainly their identity formation. I can tell you in my clinical work, I've come to believe that loss and adoption is different than any other loss that I treated for these reasons. It's less socially recognized. We celebrate adoption. It's pervasive. It's lifelong. You might start working with a young person at 7 and have the honor and opportunity to work through the lifespan a while, and you'll see that this doesn't go away. It's just processed differently at different developmental stages. It's intergenerational, and the part that I think sets it apart from other losses that you deal with clinically is this issue, Lisa touched upon this, about the ambiguity, that there really isn't closure, there isn't finality around a lot of the losses, and it's potentially reversible. And also that I think in a therapeutic environment of ours, that we have very few rituals to help our children express loss, and this training will give you those tools. So really the treatment goal is we have to afford our children the opportunity to express their grief and mourn their losses. And I know for some of you, this will seem like, wow, that's what I do all the time. And others, this might be more of a challenge of really settling in and working with our children that have pretty profound losses. So another construct that the training will address deeply is the concept of identity formation and the complexities of the developmental framework of adoption and adolescence, and how adoption can really complicate what is already a challenging developmental stage for a young person. So why does identity matter? When we consider the traumatic experiences of children, it's easy to imagine how their self-esteem is impacted and how that affects their sense of identity. And it's common for children who are maltreated to think of themselves as some way being responsible for their abuse that they sustained, as well as being responsible for why they were removed. So part of the work is really to help them understand that this was about adult actions and adult decisions, and they're not responsible, and really help to change that self-concept that they're not a bad child, or they're not stupid, or they're not ugly, or it wasn't because they ate too much, or it wasn't because they struggled in school that these separations occurred. And they may question why their birth parents didn't take care of them, didn't love them, didn't embrace them, as they see that other children are embraced by their families. I think knowing who you are matters, and the confusion about who you are has such negative implications upon their mental health. So we see high rates of mood disorders and anxiety disorders among this population of children. And also we see high use of psychotropic medications when in fact, if we do some of the work that we will train on in this training to you all, I think that we won't have to use medication as the first go-to. So as many of the young people that we work with share, you know, I don't know anyone who else in the world looks like me. And I ask you all to think about that, you know, tonight when you go home and you might take your contacts out and take your glasses off and you're brushing your teeth and you look at yourself, majority of you will be able to reflect upon who you're connected to in this physical way, and what the power is to not have that information just further complicates the journey of one's identity. So as we talk more about identity, and as I said earlier, we're working with a very culturally, racially diverse population of children. So where did I come from and where do I belong? Racial identity and cultural identity are significantly important. And when Lisa had shared with you the preliminary results from the mental health pilot, module 6 was on race, ethnicity, culture, and diversity. And that was one of the second to lowest scoring by our practitioners. And I also want to say that the majority of the practitioners in the pilot had over 13 years of clinical experience. But this is an area that we don't have a lot of training around. And we're hoping that this NTI will provide you with a more comfort in dialoguing with your clients around issues related to racial identity, racial socialization, and cultural identity. You know, really helping them understand, what does it mean that I'm Asian or I'm Chinese, or I grew up for many years in Ethiopia and my skin color is different from my adoptive parents. I think in adolescence, this rears its head in a pretty vibrant way, as again, our youth are trying to figure out who they are and where they came from, and how to integrate the complexities of one's racial identity. And then we have this slide that's titled Divided Loyalties. Loyalties and conflicts already exist in families, and we know can be magnified by the change in the legal status of moving into adoption. And really, for those children that you may be supporting that moved into their adoptive families later in life and have strong connections and relationships and memories of their birth families, we begin to see a clinical picture where there are divided loyalties. You know, I love my birth mom. I know that she had issues and she hurt me deeply, but I still love her. And I also love my adoptive mom. Or I'm thinking about my foster mom, you know, Lisa, and I miss her. And can I have a relationship with her at the same time? Will my adoptive parents feel threatened? So this is another piece of work that's, I think, very unique in what we call the area of adoption competency. So what happens is that the children and adolescents experience a lot of guilt related to these frequent and intense thoughts about their birth parents. And, you know, I know right now we're struggling to support kids through COVID. We've been working with, and interesting issues come up where they're thinking about, are their birth parents that are living in other countries impacted by the virus, and are they still alive? And can I talk to my adoptive parents about this? Will they be upset if they know that I'm thinking about my birth parents? I mean, I think that's a really perfect example in this clinical specialization and knowledge base. And I think they fear, as I said, disapproval, that their parents may be upset, and therefore they might go internalize these thoughts and feelings, which, you know, lead to further mental health problems. So this treatment goal would be to remove their sense of guilt and normalize the feelings for the birth parents. And I think you'll see throughout the training that we're guiding you and helping you to normalize a lot of these issues that are, as I said before, inherent in working with this population of children. So when you sit with the kids and the adolescents, these are some of the questions that they have. Why did my birth mom leave me? Is she okay? Where is she? Who will I look like when I grow up? Was my birth father a good person? Do I have siblings? And we're hoping again that we'll give you through NTI the tools to open the dialogue, to have the conversation, and to help them chart this journey of exploration that they need to chart. So the missing and difficult information is how do you help them cope with that, whether for those children that have no information or children that have some very difficult information. My story could be that I was a product of rape, and how do you help then the child embrace that aspect of their story? Or how do you help children with no information? I had a young person that I worked with who was thrown in a dumpster and left to die, and there is no information about her birth family. So how do you begin to help them navigate this information? So here, the treatment goal is to support the child or adolescent in the integration of their cohesive self. And, I have to say that this is not short-term work. For many of you, you will be embarking upon a therapeutic journey that spans a longer period of time that maybe you're used to clinically. And, sort of a final construct is this concept of a forever family. Our children become anxious from time to time that they've lost one family, might they lose another? And how do we help them feel claimed and feel secure in the family that they're with? So no, it's not. It's deep, and I think what this reflects is the work is deep, and many of the kids that we wrote this curriculum for are struggling, and parents are struggling because they may not understand their children's behaviors, they may not understand their mental health challenges, and I'm hoping today, just with this small little webinar, that we've given you a smattering of some of the core constructs in which this curriculum was built, and how we can be a lifeline to those that you've chosen to support in your clinical work. So we want to affirm that this is a forever family. We want to help the children understand and maybe get some more insights about their own behaviors and how it reflects their sense of insecurity when we think about permanence, to support the healthy and appropriate launch to independence and adulthood. And that trajectory is going to look a lot different too, depending upon the history of the children that you're working with. And we speak a lot about that in the training. And helping some parents understand the need for a slower transition as they think about emancipation and individuation. So, I'm proud that we have been able to create this incredible training for you all, and it will build upon the competencies to address the issues that Lisa and I have lightly talked about today in the short time that we have.
So Debbie, if I may, I'm going to just talk just briefly about the curriculum. So for anybody who hasn't been to our website, can get a little bit of an idea of what we're including in the mental health training. I think we mentioned earlier, Debbie mentioned that there are 2 trainings. One is for child welfare and one is for mental health. The mental health has 10 interactive modules, really focusing on clinical practice. The total training is about 30 hours, and it might take a little bit longer if you go through all of the hundreds, I would say, of resources that we've got embedded in the training. The mental health training includes new assessment and treatment strategies that you will see through an adoption lens, and also provides information on 12 evidence-based treatment interventions. It is not a training on those interventions, but does provide links and resources on some of the specific interventions. Our training has been approved by NASW for continuing education credits, and we can talk more about that. Got some questions about that as well. These are the competencies that are embedded in the NTI training, and again, the first 8 are really well aligned with the child welfare training, and the last 2, assessment and treatment planning and therapeutic parenting strategies, are in addition to the 8 that are included in child welfare. So for, again, a total of 10 modules in the NTI mental health training. The trainings are very well aligned, as I mentioned earlier, and support that shared language across the child welfare and mental health arenas. This is just a real brief sampling of some of the tools that we have embedded in our training. Improved assessment, we've got some fun tools for kids to use. Bird nest drawing, Mr. Nobody, whose job was it? Loss and memory box, life book work, digital stories. I've been working in this field for a very long time, and I was able to pull some new strategies out to work with kids and families. Just download it and walk out the door with them. So a lot of really good information. So now you might want to know how to access NTI. It's pretty simple. If you just click on our link right here, adoptionsupport.org/NTI. NTI is accessible through the case learning management system currently. It is free and accessible for anybody in any state, tribe, and territory in the United States. If you access through the case learning management system up through the end of September, or as long as our funding lasts, it will be at least through the end of September of this year, you can access NTI and get free CEUs, free NASW approved CEUs. There are other ways to access NTI. It will be available through the Children's Bureau learning platform, which is called CapLearn. And the website is available on our website. The link to CapLearn is available on our website. It also is available, NTI is also available through a number of host sites across the country. And we do have a listing of host sites, again, on our website, so you could take a look at that. We're happy to answer any questions about access now. So I just want to say, again, we've had such a great response from our evaluation, from our pilot sites, from people who are continuing to enroll and participate in NTI. It really is a fabulous training. It's web-based, it's interactive, it's self-paced, you do it at your own pace. It's free, and as I said, right now you're able to access CEUs free, which is also a really nice advantage for mental health professionals. And I guess we can open it up to questions now.
Hey, Lisa, we have a question from Stacy who asked about if you could talk about how this is different from Tack. She said she was recently asked about that difference.
Sure. So I'll try to address this. It's Debbie Riley. You know, Tack is a 72-hour training that is much more intensive than this training. I mean, I think they're both really important trainings. The NTI is free because we were able to, again, get the support from the Children's Bureau to create this training. So, you know, I recommend that you all do both. I think that if you're really wanting to commit to working with this population, then I think both trainings are just fabulous. As I said, one's classroom-based, this is web-based. NTI has a integrated, I mean, the competencies are I think, very similar in a lot of ways. One's just a lot more intensive than the other.
I think I saw a question about recruitment and training for adoptive parents pop up. And so we don't currently have a specific training for adoptive parents, but a lot of our sites, pilot sites, did use this NTI to support and enhance their training for adoptive families, pre-adopt families, and in recruitment as well. So two things. The folks who were trained in NTI felt like they could do a better job of training prospective foster and adoptive parents and help them to have a better understanding of the children who are in the child welfare system specifically, and then increased understanding and awareness of the children who will come into their family through adoption in any way. So NTI really does cover not only child welfare, but also international adoption and infant adoption. And so the reports were that this was really useful in the recruitment and training of the foster and adoptive parents. And then for the training for the parents, while this is not meant to be a training for foster and adoptive parents, there are a great many resources that folks can use, download, and hand out to foster and adoptive families so that they can have some really good resources at their fingertips. Emily, what else have I missed?
Sure, we have another question that came earlier on in the presentation, and this is really, more asking for some advice around adoptive placements. This person is asking, to your comment, Lisa, you said that healing happens in families. So is it better practice to move children to adoptive homes prior to achieving mental health stabilization rather than waiting in the hopes that the child will stabilize in foster care or residential treatment? Debbie or Lisa, want to take a stab at that one?
Debbie, so it's sort of outside the scope of our training, but
I mean, I think, yeah, I mean, obviously we would all want to see stable permanency for children. And I think that, we agree that healing happens in families, and it is a better practice if we can transition. But on the other flip side is that we also would like some of the mental health work not to be addressed prior to finalization. And I think that's what we're training on the child welfare side, is that we want some of this work to be ongoing as we're thinking about permanency, whatever that permanency looks like. So I hope that addresses your question. Obviously, we don't want to see children in congregate care. I mean, we want children to thrive in families. I think that's probably what you're asking.
Here's one that's maybe a little easier about NTI. So after you complete the course, can we be listed as an adoption competent therapist at NTI?
So that's a great question. So this is not a certificate program. At the end of NTI, completers will get a certificate of completion and can get CEUs, as we mentioned. And then they could also sign up on our National Directory of NTI trained professionals. Again, it's not a certification program, so we're not endorsing any completer as a certified adoption competent mental health professional.
Right, and I guess that goes back to the earlier question of differentiating NTI and Tack. So that program will have an accreditation for practitioners. You're going to have to pass an exam to get accredited through Tack.
Any other questions, Emily?
I think we covered them all. You might just want to say again how to access it.
Okay, sure. So to access NTI, go to our website. Let's see, we'll put the previous slide up. Let's see, here we go. adoptionsupport.org/NTI/access. And it's very, very easy. You click on the link, you will go through an enrollment process, which is pretty much filling in your contact information. And then you'll be enrolled in the training and you can get started.
I have a quick question to those listening. Since we have about 5 minutes, I think Lisa and I were really intrigued. We have several hundred of you today on the webinar, and we're just kind of curious about what brought you to the webinar and why you might be interested in the training, because we're so excited to try to engage you to take this incredible opportunity. So I'm just kind of curious if anybody wants to type in anything, what led you to sign up today. So I see that permanency specialist, director of an agency, Delaware, some folks from Delaware who's going to be working with one of our implementation specialists, and not surprising, several moms who are also mental health professionals, and this is your passion. Psychologist who's worked over 20 years in Columbia as an adoption psychologist, now with an adoption agency. And I really appreciate the next comment. I'm a therapist and I struggle to help adoptive families to understand in ways in which trauma affects the family. I think that's what you meant. Looking for more support for adoptive families, the impact that trauma has upon the brain, wanting to assist foster parents to connect with their children. Somebody that's already finished Tack, so this is interesting, and even wants more knowledge and wants to take NTI. So, I appreciate you sharing this because it means a lot to us. Somebody that just signed up for the course believes that it's a benefit.
Yeah, I see a question here about getting the CEUs, and do you have to take the entire training? So our entire training is what is approved for CEUs. You have to complete beginning to end in order to get the CEUs.
Once you get in, you'll understand why. I mean, we really see this as a comprehensive training, just taking 1 or 2 modules. We really try to weave content throughout all of the modules and integrate the content. So I know it might feel like a lot of hours, but once you get in there, it's really unique. Like, it's not like other webinars or web-based trainings that you've taken. I know I just recently took one where you're just reading and reading and reading. There's nothing to engage with. There's nothing to watch other than reading words. And I think you're going to get on and be really surprised about how I think it's fun. I mean, I think it's a great, engaging training.
Yeah, and it's very interactive. So you're not going to be able to put this on and just be cooking dinner or doing your emails or take a run or something. You really need to be engaged in this and answering questions and watching the videos. We've got a lot of fabulous videos embedded in here, interviews with adopted individuals and parents and professionals. It's really terrific.
Yeah.
Lisa,
no,
sorry, this is Emily. Yeah, we've had several questions come up around, is there a time frame for completion? And I just wanted to highlight, I wrote in the box, because we have the question come up again. There isn't a time frame to complete the training, but we do recommend around 3 months.
Yep. Yeah. Well, and this is in regard. Thanks, Emily, for that. This really is in regard to adult learning principles. If we start a training and say I could finish it sometime, someday, we tend not to. But if we give ourselves some kind of a deadline, we're more likely to complete the entire training. If you enroll through our website, through the Case LMS, it is free. If you enroll by the end of September, you can complete it for free, even if you go beyond September 30th. This training will also be available free on the CapLearn website and the Children's Bureau training platform. And also, as I said, through a number of our states and local entities as well. So the training itself is free. It's just plain free. Yesterday, somebody asked me if they would have to pay for travel. It's all web-based and self-paced and totally free. So please take a peek at it.
And Lisa, just to clarify, right now, today, like, tomorrow, if you decide you want to do this, this is the website that you should access to access the training right now. That's right in front of you, the adoptionsupport.org NTI access, okay?
Yep. That's the way to do it, for sure.
We had a good question here. Catherine had asked, she works with treatment foster care in a treatment foster care agency, and for her case managers who do a mix of both clinical work and case management, do we have a suggestion between the two trainings? Should they take child welfare or mental health?
My opinion is I would do child welfare. I think for your case managers, I think they would find that I think more beneficial for them, for their scope of work. That's just my opinion.
And Catherine, we do have our learning objectives and detailed outline on our website of the learning objectives and the skills and competencies for each training. And so you might take a look at that to have a better idea.
Great question, though. Great question. Mm-hmm. And, offline, I mean, if you get in there and you need some more help, you're welcome to contact Lisa to give you some more guidance around that.
For sure. And there's a question about the data and the evaluations. So I just wanted to also point out that on our website, we do have, there's so much information on our website. So do take a look. We've got evaluation data, we've got access, we've got lots of implementation guidance. We have tip sheets and transfer of learning guides. Our website is so rich. It's just really, it's impressive. I was impressed. Went back through it yesterday with Karen, our marketing person, and it's just, you could spend a lot of time looking through the information that's on our website. The learning objectives, the core competencies, we've got it all. So we're just about at the 4 o'clock mark. I would like to say thank you to everybody. Again, I'm Lisa Maynard. I'm the implementation specialist with NTI. I'm happy for you to contact me at my email or send me a voice or text message. Happy to give you more information if you need it. Take a look at our website, enroll in NTI, and then let us know what you think about it. We're really happy. We think it is a fabulous training and really will benefit kids and families across the country. So we're really excited about that.
Thank you, Debbie. Thank you so much. We're so excited, as you can tell, and we hope you'll join the NTI family and be a part of such an incredible training opportunity.